Dr. Rao, you have played an instrumental role in implementing a comprehensive and decentralized national AIDS program. You headed NACO to Secretary General. What is the transition you see personally in the last 20 years?
I think when I joined NACO, I think the epidemic was at its peak almost. We are having a huge number of new infections, and there were no treatment at that time available. So people were dying in large numbers. And the type of political support that is needed for the program was not forthcoming at the time. The country was still living in a denial phase. From there, in the last 20 years, I think we have brought it to a stage where I think India can be proud of having one of the most comprehensive and most successful AIDS control programs in the world. Because we have not only controlled the new infections, the rise in the new infections, but also tried to bring it down by substantial number in the first decade, that is from 2000 to 2010, but maybe at a slower pace in the second decade also, from 2010 to 2020. So there is a complete change in the course of the epidemic.
Dr. Rao, if I could come to you here, throughout your career, you have consistently advocated for the empowerment of the vulnerable communities. The key population groups that are particularly vulnerable to HIV frequently lack adequate access to services. How can we break away from this and ensure that no one is left behind? We have been talking about how important it is, and also it's one of the SDG goals.
See, that was the main challenge in the case of HIV, because right from the beginning, we have seen it is these populations whom we call key populations now, the vulnerable populations, they bear the brunt of the epidemic. And the latest estimates of UNAIDS last year has shown that not only in India, but in the entire Asia-Pacific region, 95% of the new infections are occurring among these key populations. That means sex workers and their clients, gay men, transgender population, injecting drug users, prisoners, people who are at the bottom rung of the economic and social ladder. So unless we really target them with programs for prevention and also bring them for testing and treatment, and most importantly, look at the legal environment surrounding them, so that, how can we decriminalize those behaviors so that they can be like any other citizen, accessing all the benefits of that society and governments are giving. So that is the real challenge. So legal reforms, to my mind, I think is very, very important.
Dr. Rao, if I can just ask you, something we've been talking about, what could be done, but since you've been so long in the system, do you think we have enough finances for the AIDS program in our country?
I'm not really worried about the finances part, because the latest National AIDS Control Program Phase 5, I think it has committed 15,000 crores for 5 years. So funds, I don't think will be a problem in India. It's a question of how you use those funds. In the last 10 years, an entire new generation of young people, aged between 10 and 18, are born without any knowledge of AIDS, without any knowledge of HIV. I think that is a huge risk factor in our country which we are carrying. So I think, so far as I am concerned, money is not a problem, but things are not happening to the desired extent. You mentioned about the SDG. We have put very lofty targets for 2025 and also 2030. We are falling behind. We are not going to achieve any of them if it is business as usual in this country.